Hey, I'm Trevor and I'm going to be your nurse today. Okay, let me wash my hands and then we close the curtain for some privacy. If I could I get you to just state your name and date of birth?
Jenny Hamilton, January 4th, 1997.
Okay, that checks out. Do you have any allergies I need to be aware of today?
No.
Okay, do you know where you are?
Yes.
Where?
I'm at the Kroll residence.
Okay, do you know what time it is?
It is 5 o'clock.
Okay, what brings you in today?
I'm here for a health assessment.
Okay, patient appears alert and oriented ×3 and her speech and posture is normal. Okay, do you know what a health assessment is?
Kinda.
Okay, what it is I'm going to work my way from your head to your toes, just checking body functions and their systems and make sure everything is working adequately. Do you have any questions about?
No.
Okay, do I need to know anything before I begin?
No.
Okay, where I'm going to start is I'm going to start at the scalp and just palpate for any lesions, any masses, tenderness, checking for any lice or mites. Also checking to see if your hair is full, if it's coarse or fine. Everything seems to be normal there. So right now I'm going to check for the temporal pulses bilaterally. Okay, everything seems normal there. They are similar, about a 1 or 2 plus. Okay, now I'm going to check your external eye, your eyebrows, your eyelashes, your pupils if they are equal, which your eyebrows are normal, so your eyelashes, your pupils seem equal. Okay, let me put some gloves on real quick. Okay, now I'm going to assess your sclera, which should be white, and it is. And then your conjunctiva should be pink, which it is. Okay, now what I'm going to get you to do is just stare straight ahead. Okay, and I'm going to check your pupils to see if they constrict. Okay, and they do. Alright, now can I get you to focus on those blinds over there? And now can you look at this pen? Okay, and the pupils did accommodate, so it's Perla, so the pupils are equal, round, reactive to light, and accommodation. Okay, now what I'm going to get you to do is I'm going to get you to follow this pen light. And what I'm doing right now is I'm just checking for any nystagmus, any fluttering or stuttering of the eyes. And seeing if the eyes are following parallel, which they are, so everything is normal there. So now, what I'm going to get you to do is I'm going to check your nares to see if there's any obstructions. Maybe I'll reach you to blow out. Okay, and then blow out again. Okay, there's no obstructions there. Could I get you to just tilt your head back? And I'm going to look inside your nose for any masses, lesions, any discoloration. The membranes look pink and everything looks normal there. Okay, now I'm going to assess your ears. Right now I'm just going to inspect the ears for color, any masses, lesions, the size. I'm going to look at the size. And then when I come over here, I'm going to look for the symmetry in them, along with masses, lesions, the color. The color, it looks good for her ethnicity and race. And they do seem to be symmetrical bilaterally. Okay, now I'm going to inspect the internal ear. I'm going to pull up and out and check for any masses or lesions or discoloration in the internal ear, which everything seems normal on the right ear. So I'm going to do the same on the left, and everything seems normal there. Okay, do you have any pain or discomfort in your ear?
No.
Okay, so then I'm going to palpate bilaterally. Could you just tell me if you feel any discomfort or pain in the process?
Okay.
I am palpating for tenderness along the ears. Do you feel any pain or discomfort or anything?
No.
Okay, that's good. Alright, now what I'm going to do is I'm going to check for hearing. Could I get you to just close your eyes and tell me when you hear something?
Okay. Okay.
Alright, the hearing is intact. Okay, what I'm going to get you to do now is I'm going to get you to make some faces. Could I get you to just raise your eyebrows? Okay, now squint your eyes really tightly. Alright, now puff out your cheeks. Alright, now smile. Now grit your teeth. Alright. All of the facial nerves seem to be intact. The facial. Now we're going to move to facial sensation. If I could I get you to just close your eyes and tell me when you feel something?
Okay. Okay. Okay.
Alright, facial sensation seems to be intact. So now we're going to look at the mouth. If I could I get you to just open your mouth and stick your tongue out and tilt your head back a little bit? Alright, now say ah. Okay. What I'm looking for now is just any discoloration, any lesions, masses, hygiene. The tongue seems to be a normal color, which is pink, and no lesions or masses. Okay, could you put your tongue up? Okay, now I'm looking at the teeth, and the hygiene of the teeth and the mouth seems normal, and there are no cavities or discoloration of the teeth, and she seems to have all of her teeth. So what I'm going to do now is I'm going to palpate your sinuses. If you feel any tenderness, pain, discomfort while I'm doing this, just let me know. Okay, do you feel any pain or discomfort? Alright, that's good. Okay, what I'm going to do now is I'm just going to check your carotid pulse. I'm going to check both sides, but just one at a time, so you don't pass out. Alright. Okay, they seem symmetric bilaterally and about a 2+. So what I'm going to do now is I'm going to check for any swishing sounds or bruise with the bell of the stethoscope. If I could I get you to just hold your breath for a second? Okay, let it out. Alright, and then this side one more time, hold your breath. Okay, you can let it out. There was no swishing or bruise sounds. So what I'm going to do now is I'm going to check your trachea for midline. If you feel any pain or discomfort, just let me know while I'm doing this. Okay, trachea seems midline, and I did not palpate the thyroid gland, so I'm inferring that there is no inflammation in the thyroid gland or enlargement. Okay, now I'm going to palpate your lymph nodes and your neck and head. If you feel any pain or discomfort, just let me know. Alright, and then in front, behind the ears. Okay, I did not palpate any lymph nodes. So what we're going to do now is we're going to auscultate. Well, first, I'm going to check for jugular distension. So could I get you to just lean your head back at a 30 or 45 degree angle? I do see slight pulsation of the carotid, but that seems normal in a female this size. And there's also slight carotid pulse on this side, but no jugular distension on either side. So what we're going to do now is I'm going to check your lung sounds for any crackles, wheezes, rails, rhonchi. With the diaphragm, if I could I get you to just take a deep breath and let it out? One more. Okay, and again. Okay. And one more. Okay, and again. Okay, there was no abnormalities on posterior. Now, so I will move to anteriorly. If I could get you to just take a deep breath. Another one. Another deep breath. Another deep breath. One more. And again. Okay, I did not hear any crackles or wheezes, rhonchi, or any adventitious sounds posteriorly or anteriorly. So now I will check laterally. Can I get you to just hold your arms straight up? Alright. Can I get you to take a deep breath? One more. Okay. And can I get you to take another deep breath? And one more. Alright, I did not hear any adventitious sounds laterally. So what I'm going to do now is check the APL ratio, which should be 2 to 1. Could you raise your arms up a little bit? And it seems to be 2 to 1. Now I will check the costal angle along with symmetric lung expansion. Could you breathe in and out? One more time. Okay, the costal angle does appear to be 45 degrees. Now we're going to check the for symmetric lung movement in the back along with the slope of the ribs. Could you just breathe in and out? One more time. Okay, the slope of the ribs does appear normal along with the symmetry of the lungs. So what we're going to do now is we're going to auscultate cardiac sounds. We're going to start with the pulmonic. Okay, now we're going to auscultate the aortic. Okay, and then herbs, tricuspid. And then for the mitral, we're going to listen to a full minute, which is also called the apical pulse, and we're going to find a heart rate. Okay, after a full minute, her heart rate was 64 beats per minute. So now we're going to switch over to the bell, and we're going to auscultate the heart sounds again, and listen for any murmurs or adventitious heart sounds. And we're going to start at the same position, the pulmonic. And then aortic. Herbs. Tricuspid, and then the mitral valve, and there were no adventitious sounds there. So what we're going to do now is I'm going to get the patient to lay flat and lift up her shirt to show her abdomen. And right now I'm just going to inspect the abdomen for any masses, lesions, distensions, any abnormal pulsations. There is a slight pulsation from the aorta, but with a female this size, that's common and normal. So now I will auscultate with the diaphragm of the stethoscope, starting at the right upper quadrant, and I'm going to just listen for bowel sounds. To the left upper quadrant, and then the left lower quadrant, and then now to the right lower quadrant. Okay, bowel sounds were normal. Heard them about every 5 seconds. So now what I'm going to do is I'm going to auscultate the aorta, the right and left renal arteries, the right and left iliac arteries, and the right and left femoral arteries for any swishings or bruits with the bell of this stethoscope. So right now I'm going to start with the aorta. The right renal. The left renal. The left iliac. The right iliac. The right femoral. And then the left femoral. Okay, I did not hear any swishing sounds or bruise, so everything is normal there. Now I'm going to ask the patient, do you feel any pain or discomfort in your abdomen right now?
No.
Okay, well right now I'm going to lightly palpate the abdomen. If you feel any pain or discomfort or tenderness at any time during it, just let me know and we'll stop. Okay, right now I'm just going to palpate lightly for tenderness, masses, anything abnormal. Starting in the right upper quadrant to the left upper quadrant. Now I'm at the left lower quadrant, and then now the right lower quadrant. Okay, did you feel any pain or tenderness there?
No.
Okay, so what I'm going to do now is I'm going to palpate deeply. If you feel any pain or tenderness or discomfort there, just let me know. Okay, what I'm going to do now is I'm going to palpate deeply and note any masses, enlargement of any organs. The right upper quadrant would be the liver, and then the left upper quadrant would be the spleen, and then the left lower quadrant would just be the intestines, if there's any enlargement or masses or tenderness there. And then the right lower quadrant would be the appendix, and there does not seem to be any enlargement or tenderness there. So I'm going to get the patient to sit up, and we're going to inspect the peripheral nerves. We're going to start with the upper extremities. What I'm going to do now is just inspect the upper extremities for color, any lesions, masses, any abnormalities like that, and there doesn't seem to be. So we're going to test for temperature, and the arms seem to be warm to the touch, and then the hands seem to be cool to the touch. So now we're going to palpate the brachial arteries bilaterally. Gotta get you just like this, okay? Okay, the brachial pulses seem to be symmetric and about a 2+. Okay, now we're going to work our way down to the radial pulsations and test them bilaterally. Okay, those seem to be symmetric and similar and about a 2+. And while I was palpating the radial arteries, I was also listening to her breath sounds, the rate, the rhythm, and everything seemed normal there. Okay, so now what we're going to do is we're going to test for skin turgor. The left hand, right, and that seems normal. The skin retracted immediately. So we're going to check for edema bilaterally and just work our way down. Okay, there seemed to be no pitting there, so it was negative for edema. So what I'm going to do now is just inspect the nails for any hangnails, any discoloration, lesions, anything abnormal. If the patient bites her nails, anything like that. And we're going to inspect the angle. So we're going to inspect for clubbing. So I'm going to get you to hold your nails up like this and nails together. And there should be a space, which there is. So there's a negative sign for clubbing. So we're going to check for capillary refill now. In the left hand first. And it does appear that her capillary refill is under 2 seconds on the left hand. Okay, and capillary refill is under 2 seconds on the right hand. So what I'm going to do now is I'm going to get you to grab my fingers. Just grip them as tightly as you can. Okay, and she can in fact grip, so that reflex is intact. So what I'm going to do now is move to the lower extremities. Could I get you to uncross your feet? Okay, now I'm just going to inspect for any discoloration, any noticeable masses, lesions, anything that looks abnormal, and there doesn't seem to be. So I'm going to check for skin temperature with the backs of my hand, and the legs feel normal, and the feet are slightly cold. So what I'm going to do now is we're going to check for popliteal pulses, and could I get you to move forward a little bit? Okay, now I'm just going to check popliteal pulses bilaterally, and they do seem symmetric, so we're going to go down to the dorsalis pedis pulse at the right first. Okay, and then the left. And they do seem similar and about a 2+. So we're going to go to the posterior tibial pulse and check that bilaterally. And this is on the inner side of the ankle. Okay, those also seem similar and about a 2+. So now we're going to check for skin tugger. Just pull up right here, and then now on the left, and the skin retracted immediately. So we're going to check for any edema in the legs, for any pitting. Okay, there does not seem to be any pitting. So now we're going to inspect the nails for any hangnails, discoloration, any abnormal growth on the right and left. Then there does not seem to be, so we're going to check capillary refill on the left, and the left is under 2 seconds, so we're going to move on to the right, and that capillary refill is also under 2 seconds. So what I'm going to get the patient to do right now is just lie flat, and we're going to perform the Holman's test. And what that tests for is a deep vein thrombosis. And if you feel any pain or discomfort in your calves or anywhere during this, just let me know and we'll stop. What I'm going to do is just push the foot towards the knee. Do you feel any pain?
No.
Okay. Do you feel any pain now?
No.
Okay, if there was any pain, it would be in the calf, and that would indicate that there was a deep vein thrombosis. But since there was no pain, it is a negative test. So what we're going to do now is we're going to test for sensation in the feet. If I could I just get you to tell me when you feel something?
Felt it.
Okay, which foot?
Right
Okay.
and left.
Okay, okay, it was the left foot.
Mm-hmm.
Alright, could I get you to just sit up? Okay, what we're going to do now is we're going to test for reflexes, the deep tendon reflexes. Could I get you to just hold your hands like this and close your eyes? Okay. Okay, that was a very hyperactive reflex. So what we're going to do now is we're just going to let you hop off of the table real quick. And we're going to move this out of the way. Okay, now I'm going to assess for posture, gait, and coordination. Could I get you to just stand right here beside me? And could I get you to walk towards the door? Okay, now could you walk heel to toe back towards me like this? Okay, coordination and posture seems normal. Now we're going to check for range of motion. Could I get you to just twirl your neck? Okay, and then hold your arms out like this. Like this. Okay. Could I get you to rotate your arms? Okay, now hold your arms out like this and this. Okay. Now could I get you to twirl your wrists? Okay, that's good. Alright, now we're going to do hip movement. Could I get you to just to the side, to the other side, now backwards and frontwards. And now could I get you to lift your leg out like this, and now your other leg, and then frontwards, the other one, now backwards, and the other one backwards. Okay, could I get you to just lift your knee up? Yeah, like that, and now the other one. Okay, good. Now could I get you to just roll your ankle? Okay, and then roll your ankle again. Alright, now could I get you to just put with the heel of one foot and rub it down the, rub it down.
Okay.
Okay, now do the other one. The same. Okay, now could I get you to just stand on one foot? Okay, now on the other one. Okay, good. Now could I get you to hold your arms out like this, and then just move your hand to your nose, and keep doing that. One more time. Okay. Now could I get you to just move from each finger to your thumb? Alright, that's good. Okay, now what we're going to do is we're going to do the Romberg's test. I'm just going to get you to stand with your feet together and your arms down by your side and close your eyes. And what that does is we're going to see if she can stand or if she falls for 5 seconds. And if she falls, that would indicate a positive Romberg's test. But since she is not falling and seems to be standing still, that means that she has a negative Romberg's test. You can go ahead and open your eyes. Okay. That seems to complete our assessment. Do you have any other questions for me or concerns?
No.
Alright. Do you need anything else before I leave?
No.
Alright. It was nice to meet you.